Hello and welcome back. So today we are going to start our lecture on fibroids, which are also called leiomyoma. Actually, it's a very common condition in the reproductive aged women. Anyways, so our learning objectives for this lecture will be, by the end of this lecture, you should be able to describe what are fibroids and what to know what type of fibroids is that. Identify the common symptoms of fibroids, discuss potential complications that can arise from fibroids, outline the different diagnostic methods for fibroids, compare and contrast the various treatment options for fibroids, and discuss how fibroids can affect quality of life. So, fibroids are not cancers, okay? So, in definition, what do we have to say? These are the benign tumors which arise from the uterus, and they are characterized by the proliferation of uterine smooth muscle cells. In simple terms, they arise from the myometrium. Okay, so because endometrium does not has smooth muscles, right? It's only the myometrium. They mainly contain myocytes, these are the cells, right? So smooth muscle cells, and are characterized by excessive deposition of extracellular matrix and primarily collagen. Okay, so basically they arise from the myometrium. They are not benign, and they are very common actually. Okay, so the prevalence, so usually the quoted in some studies, it's even mentioned that almost 70% of women in different populations of reproductive age group, they can have fibroids. Okay, you do not need to remember the prevalences or incidences. So what causes fibroids actually, and why are they more common, and why do they happen in reproductive aged women? Okay, so their food is mainly estrogen. Okay, but now it is also known that progesterone also causes growth of fibroids. Okay, so estrogen is the main substance that's the food of fibroids. Okay, so that's why it is related to reproductive aged women. So if a woman has fibroids, and if she reaches menopause, when the estrogen levels go down, the size of the fibroid, it goes down, it shrinks. Okay, because the main source is the more main nutritional source is gone. Okay, so usually they are not seen before menarche, before the periods start. Okay, and that's why they increase in size in pregnancy, because there is a lot of estrogen, right, in pregnancy. So we do expect increase in size, but we don't know how much will it increase. Okay, but most of fibroids, they do increase in size, so it's important to monitor when a patient with fibroids is pregnant. Yeah, second is progesterone. Progesterone is also important. So they increase mitotic activity and reduces apoptosis. Okay, fibroids. Okay, so and there may be some translocations as well. So okay, but at least remember two things: estrogen and progesterone. Okay, right. So what are the risk factors which women are more at risk? It's basically any woman who is in the reproductive age, right? So that means very young and very old, postmenopausal, they are at low risk. Early age at menarche, that means if periods start early, there is more exposure to estrogen. Okay. Well, the third one, frequent caffeine consumption, there is mixed evidence. It does not mean that, like, because women say, okay, what did I do which caused these fibroids, right? Or what I should stop doing so that these will regress. Actually, there is nothing. Okay, so there is, but sometimes in studies, just kind of these correlations come up. So it's just mixed evidence. Obesity. So they're more common in women who have a higher BMI, and maybe the reason may be because adipose tissue has aromatase, right, which changes androgens into estrogens. So the more is the adipose tissue, the more is the aromatase conversion of testosterone into estrogen. So more estrogen. And then ethnicity. So fibroids are quite common in women from Africa. Okay. So, but yeah, they can happen in any women, but yeah, fibroids are quite common in African women. Now, what is the classification? Why it is important to know what where is the location of the fibroid and what is the size of the fibroid. Actually, it's very important because even the symptoms may vary, right? Symptoms, some women actually they don't know, they don't have any symptoms, and we may incidentally find a fibroid. Okay. But if it's causing symptoms, then even the location and size of the fibroid may be related to what is the presenting complaint. Okay, for example, okay, let's talk about different types. Okay, so we'll start with submucosal fibroids. So submucosal, so this is the endometrial cavity, right? This is the cavity of the uterus, endometrial cavity. So if there is a fibroid which is in the in protruding into the endometrial cavity, that's a submucosal fibroid. Okay. So, but sometimes when these fibroids grow, like even these submucosal fibroids, they can grow into the myometrium, right? So they have some component in the myometrium. Okay. So these submucosal fibroids, they may have a peduncle, like they can have a stalk like this, right? So they can have a stalk. They so what do we will call them? We will say it's a pedunculated submucosal fibroid. Okay, and then they may be non-pedunculated, or they are called sessile. Okay. Uh, so they may be non-pedunculated or they may be pedunculated. Surgically, it's easier to remove pedunculated fibroids. Okay. So, and then what is the next type? So these were submucosal. The second type is intramural. Intramural are in the myometrium. Okay. And when they grow in size, yes, they can protrude into the endometrial cavity or they can extend outwards, right, towards the surface of the uterus. And they can be anywhere. See, so when we find a fibroid, we have to notice the location. Is it fundal? Because this is the fundus of the uterus, right? This is the upper part of the uterus, is the fundus. So is it fundal? Is it in the anterior wall? Of course, this is a in this section we cannot see the anterior wall, right? So if it's an intact uterus, the fibroid can be anterior wall, or it can be in the posterior wall, or it can be even in the lateral, right lateral or left lateral, right? So it's important to notice what is the location of the fibroids. And then the third one is subserosal fibroids. Okay, so subserosal fibroids again, they grow outside the uterus. They may be pedunculated or they may be non-pedunculated. Okay, so it's important to know what is the location of the fibroid for one more reason, because subserosal fibroids usually they do not cause heavy menstrual bleeding or problems with periods because they do not have anything to do with the endometrium, right? So, do they cause infertility? Subserosal fibroids usually do not cause infertility. However, if they are very close to the fallopian tube, for example, like if they are very close to the fallopian tube and if they interfere with the patency of the fallopian tube, which means if they are causing obstruction of the fallopian tube, yes, then they can cause infertility. Otherwise, they usually do not cause heavy periods or infertility. Okay, so what types can cause heavy menstrual bleeding? It's mostly the submucosal fibroids, even if they are small in size. Okay, even if it's like 1-2 centimeter, yes, it can even cause heavy menstrual bleeding if it is submucosal. And intramural fibroids, if they are, especially if they are close to the endometrial cavity. Okay, and yes, so intramural fibroids can cause infertility, especially if they are located, if they are close, if they disrupt the endometrial and the myometrial junction. Okay. Sometimes what happens is the fibroid may be endometrial, but if it is pedunculated, sometimes it may prolapse through the cervix. Okay. So it can come out through the cervix. Okay. And if we perform a speculum examination, yes, we can see it. Okay. Actually, there is a proper classification system of fibroids. Even if you don't remember exactly, that's fine, but just remember that there is a proper FIGO classification system. So it's like 0, 1, 2, 3, 4, 5, 6, 7. 0 is So there are submucosal fibroids. They are pedunculated, which means they are in the cavity of the uterus completely, right? They do not have any component here in the muscle layer, intramural, I mean. Then submucosal less than 50% intramural. Yes, they started to grow and they are growing into the myometrium, but they are only less than 50%, right? In intramural, that's type 1. Type 2 is more than 50% intramural. 3 is 100% intramural, but in contact with the endometrium. Okay. 4 is completely intramural. It is not affecting the endometrium and the myometrium junction. Then subserosal, more than 50% intramural, but it is mainly subserosal. That's 5. Subserosal, less than 50% intramural, so it's more of a subserosal, right? 6. And then 7 is it is subserosal, but it has a peduncle. Okay, so it's okay if you don't remember this classification. That's fine. Okay, just only remember these three types: subserosal, intramural, and submucosal. And then there may be some other types like cervical, right, or parasitic. But there is one more important type of fibroids that I need to talk about. That's called broad ligament fibroids. Okay, so broad ligament fibroids, if you remember, the broad ligament lies just next to the body of the uterus, right? So it's ligament, right? It's called broad ligament because it's actually very big. Okay, it's broad, but it carries many blood vessels. Okay, especially close to the body of the uterus. Okay, so it's on both sides, left and right. Okay, now sometimes fibroids can start to grow here, and because there is a lot of space, right, it's like between two leaves of curtains, right? So there are like two curtains and something is growing in between, so there is a lot of space. Actually, there is no restriction. They can grow to very big sizes. The problem is they can cause pressure effect on surrounding structures, okay, which may include blood vessels. There is ureter as well. Remember that ureter is very close, right here. So very close to the cervix, there is the ureter. So it can compress depending on the size and exactly what is the origin, right? So there are mainly two types of broad ligament fibroids. First are called true broad ligament fibroids, which are actually arising from the broad ligament. The second one, they are actually subserosal, but they grow into the broad ligament fibroid, okay? Grow into the broad ligament. Broad ligament fibroids, if big and if they are close to these uterine blood vessels and the ureter, they can be surgically very troubling. Okay, so if they're very close to the ureter or the uterine blood vessels, they can they can be surgically headache. Okay, now what can be the presenting complaints? Always remember this: fibroids can be asymptomatic. That's why it's underlined. Okay, so patients may not know that, they may not have any symptoms. They may come because of something else, right? Someone might have had a ultrasound for some other reason, say even non-gynae reason, and then all of a sudden it is noted that, oh, they have fibroids. Okay, so, but so mainly they can cause two main complaints, symptoms, if they cause any, right? First is abnormal uterine bleeding. Remember, 30% of abnormal heavy menstrual bleeding comes from fibroids. And second is infertility. But if they grow very big, when they start to compress surrounding structures, they can cause pain or discomfort. They can cause even bowel symptoms or bladder symptoms or pressure symptoms. Okay. Now we will talk about the presenting complaints in the next part.